All right. Happy Wednesday, everybody. And thank you so much for joining. Give people a little bit of time to kind of click in to the call this afternoon. Thank you so much for joining for our August community conversation with CFHA this month. If you've joined us before, these are really informal get-togethers where we ask people to jump on with whatever's on their mind connected to the topic. And so we're really glad to have you all on today. My name is Stacy Augusto. I work with the group for community conversations, and I also do quite a bit of work with the Illinois Primary Care Association as well. So I can sort of speak to what's going on a little bit in the Midwest. Today, the topic is fall reset, right? So it's been a whirlwind of a year so far, and we thought we'd give folks a little bit of a break potentially from doom and gloom, although that's totally fine if some of that comes through in the conversation for support. But thought it might be a great opportunity to kind of reset a little bit, talk about what teams are focusing on, what's coming up for your integrated care work, and where you might want to shift your energy, your programs, and your training and things like that. So really excited to have you on. I don't want to be sort of the teacher in the room, but cameras on is a little bit better for us for engagement. So if you can put your camera on, that's great. If not, that's okay too. Just happy to have you here. We have Dr. David Bauman on the call with us and Deepu George, who, if you've been on these before, they'll be familiar to you. But they'll be helping us kind of drive the conversation a little bit. Dave, do you want to introduce yourself briefly?
Yeah, I'm David Bauman. I'm a psychologist, and I am the PCPH academic director at Community Health of Central Washington, which is a community health center in as the name indicates, the central part of the state of Washington.
Awesome. Awesome. And you probably, if you're on our listserv, have seen a bunch of amazing content and data coming through from Dave. So Dave, thank you so much for all of that. Deepu, do you want to introduce yourself?
Sure. My name is Deepu George, and I am a family therapist by training, but I do primary care behavioral health work at the University of Texas Rio Grande Valley School of Medicine. And we've been at that journey for the past 10 years, and it's an ongoing journey. We are, just for context, we are located in the US-Mexico border in the southern most tip of the United States. And so that's kind of where we're located.
Okay, great. So a lot of rich conversation probably that you can offer around that location. If you're on the call today and you want to drop your role in the chat, your location, your geographic area, I think that could be pretty cool to see where we're all coming in from and helpful to us. Dave or Deepu, just on the topic of a fall reset, anything that sort of comes to your mind, or anything you're thinking about as we go back to school, back to work?
Back to
You want to
work.
go first, Ben?
Yeah, I was just thinking for us in the clinical space, there is no back to school, back to work kind of feel because we're kind of on 12 months a year. I just don't know if that's everybody else's story, because we, technically don't have a summer. So,
No,
but
I got a text from my cousin with the kids are going back to the grind today, so that's why it's on my mind.
yeah, yeah.
Yeah.
I'm sure you'll see a bunch of that in your consultation work and things that you might see in the clinic. I think generally just right sizing for the things that we're just for context, we're scaling up one of our primary care practices, and so the big reset has been rearrangement of clinical time and
Hmm.
taking on a lot more responsibilities just so that we can have full scope integration at one of our primary clinics. And so the reset for us has been supporting each other through that process, taking on things that we need to make sure that we take on so that everybody feels supported in the process, our behavioral health clinicians, which includes conversations around well-being and being mindful about that as we ask our team to do more, but at the same time supporting our clinical staff as they fall into new roles and workflows that they haven't had to really think about. So that's one of the reset points for us.
Great, great. Thank you.
Yeah, my initial thought, one, I'm just here because I want to hear from Deepu. Joking aside, I just really always appreciate his perspective and his humanity that he brings to the work. I think where my mind does go, just as like kind of initial thoughts, there's always an irony, I think, having these conversations, whether it be about like resets or trying to promote like wellness and intentionality in the work. Because my mind will be very critical of being like, oh man, if you would have seen me at the beginning of the week, I wasn't the picture perfect example of like a reset or really having like being grounded and stuff. And I hope that's something we could talk about a little bit today.
Mhm.
That wow, let's have conversations and different strategies and different techniques about ways of enhancing engagement and joy within the work that we get to do both for ourselves and our teams. Let's just have a real freaking conversation as well. As like we're not going to feel that all the time, and I think there's almost a danger in us constantly talking about wellness, that it's something that's going to be like a trait, right? That it's like you should be feeling this way all the time, and if you ever lose it for a moment, that oh buddy, you're in trouble, And so I don't know. And this is another reason why I appreciate Deepu, because of the genuineness that comes out. But yeah, I'm excited to talk about tips and strategies and just like normalizing the hell that yeah, like resets and engagement. There's going to be ebbs and flows in that, and that's okay.
Yeah, absolutely. Especially with everything that's been flying around.
Yeah.
Um,
Can I just
Go ahead. Yeah, please.
react to Dave and things? I think I don't know about like specific tools and strategies per se. I'm sure that like we're all mental health providers of some sort here, right? Some stripe. I think we all know basically the evidence-based things that will kind of help us kind of get through things. I think one of the things that I hope we can frame and get around some energy around this conversation is over the years that I worked in our setting and thinking about well-being and burnout and all of those things. And Dave, he's a big fan of context. I'm a big fan of context. I don't think we can do the work that we do and what is asked of us and what is asked of our primary care colleagues and expect not to touch burnout. I just don't know how that's like possible to, and I think what's more toxic and dangerous is to be in this field and expecting to foolproof yourself against burnout, because we are asking people to be available in a very particular way, and almost pouring yourself out in many consultations in the work that we do. And so there's a little bit of whether, no matter how technical you are, the stories has to somehow penetrate through some things that you're holding. Because I think at the end of the day, no matter how stoic you are with your patient care, it's somehow going to rub against you, right? And so I think one of the biggest framing that I hope we can do is the idea that we could remove the expectation that burnout is something that we can really guard against, rather than kind of get into a frame of saying that can we accept the fact that if we function this way and we're asked to do it repeatedly, that the likely consequences would be that someday you're going to feel the rough edge of it, right? So that's one thing that I always think about when it comes to burnout. And then the other thing is like this reset thing. And yeah, and I think if we can normalize resetting that our teams need to do and our clinicians and our staff needs to do, and organizationally create space for them to reset, then I think we're on the right side of just embracing a normal fact of existing in the worlds that we do, which is primary care and delivering really good team-based care. So that's kind of where my mind goes around this conversation of burnout.
And today's, I know we're probably not following what we're supposed to be doing, so tell us to shut the hell up when we do need to. But the one thing I love that Deepu said, like there was a story, the PCBH stories that was shared yesterday by Jessica, and I hope when people read that story, like there's a visceral or emotional reaction, even for us not being present. We weren't the ones intervening and working on that team or working with those teenagers that Jessica talked about. And still, I hope when we read that, like there's an emotional response, there's a visceral reaction. Like my mind would get more concerned if, especially if you're doing the work, that there isn't a pool, that there isn't a sense of that. Because, Deepu and I, we talked about this regularly. Like that's humanity showing up, right? Like that's humanity that's there. There's a connection, there's a spirituality that comes up. So I agree completely. It's interesting, I won't go off on my tangent about just, how we defined, success within behavioral health is usually like symptom reduction and like trying to focus on curing. And that honestly is, I think, why we get in all these problems just across the board with stigma and why people don't necessarily like come to us. I think it also infiltrates this conversation of kind of wellness and burnout, where we're trying to cure it, right? Like we're trying to bring down symptoms within it. And it's like, I don't know. I mean, sometimes those symptoms, sometimes those things that we experience, that's humanity showing up. And I think when we try to stuff that away or blunt that away or keep that away, I think we end up in a very rigid behavioral response. And that usually leads us to a path that, is not going to be functional or not going to be useful.
Right.
Yeah. I'll just jump in here. I appreciate the comments. And I hear that. I think uh, for the fall reset, the language is a little like women's magazine-y, right? But 3 strategies to whatever. But I think, right, I think there's a little bit of um tangible things that we can sort of talk about. And I'd love to hear from the group on what's coming up for you. One thing that comes to mind around everything that's been flying around and managing teams in this environment, is just sort of organizing a little bit of like, okay, what are we focusing on now? Right. So maybe not necessarily trying to cure anybody's burnout or focusing on wellness initiatives, but as a leader, what is it that I'm helping my teams with right now? And some of the things that we're hearing are teams appreciate transparency, right? So that's like sort of a crunchy, tangible solution or something that you can hook into, right? So if you're asking more of your teams in terms of productivity, why is that? And how are we languaging those conversations? And what's going on with the organization financially with everything that's been flying around? And can we provide those answers to sort of bring down some of that anxiety? So for me, being really transparent with people and teams on what we're hearing, how things are affecting us, what like 3 to 6 month projections, as well as we can do that, right, has been really, really helpful. So I want to give the group a chance. I know a bunch of you have jumped on. Is anybody want to come off mute and just sort of share what you're thinking on this topic or what's going on with your teams? Or why you joined? We do have some questions in the chat, actually, so that's also another way to engage. Deepu or Dave, this is a specific question. Any sort of specific strategies within integrated care that teams can use within the corrections system? Any thoughts on that? Or any protocol?
Yeah, Stacy, I think the one thing that you just said, I think is really important. And, if there's like kind of transcending kind of aspects for the like reset and prompting engagements with the team, I'm a big data person. I think it's important to track data and different things. But the truth of the matter is like a data point is irrelevant. It's not good or bad. It's not functional or unfunctional until it's placed in a context where we have kind of a value that's defining that context. So I think regardless of the system that you are in, there has to be defined values and missions that we're moving towards. There's a great book by Simon Sinek called The Infinite Game that talks about this, and that, data used just indiscriminately, usually again, is a very rigid behavioral response, and we head down roads that, we don't want to have. And so I think the one thing that I definitely encourage people just to do is that while for sure data should be tracked and we should have, primary outcomes and letting the team know all these different things and celebrating those things, never losing sight that data is a reflection of values, and kind of gaining this idea of like where we're moving towards. And I love that you said about like the productivity thing, productivity for productivity's sake, like I don't know. I don't get really excited about that
Mm-hmm.
in a lot of ways. I tell you what, though, productivity, because it's a reflection of me being able to serve my community that is underserved and resource depleted, and that I want to get out to people as much as I can, because I believe the work of BHCs can be life breathing for folks. Like, damn right, productivity becomes an important metric
Right.
that I want to track. So for those people in the, correction facility, making sure to define, what your values, your missions are, and then trying to really drill down to specific objective, or kind of data that can be tracked and connecting those with the team often.
Yes, I love that. That's great.
Yeah. I mean, I would echo the same thing. And I think what is if you're asking people to drive more, having them buy into that and connect it to their personal values and the organizational values, I think it's very important. We are in the process of um, we're in a newer clinic within our system, and so like same day appointments creates a lot of extra workflows for our front desk staff, and so we spend a lot of time with the front desk staff, right? We talk to them about why we do it. I remember I spent like a lunch hour just chatting with them and explaining what a contextual interview is and what we do. Why do we see same day visits, and why same day visits are really a big priority for us. There are two ladies up front who have gone the extra miles, created systems, already kind of tells us which insurances don't need like additional clearance, that we can just immediately go see them, right? Like they have worked that around, but now they know what we are doing in there, right? And I think whether you're in the correction system, whether you're in a regular primary care system, that it's definitely an extra burden on their stuff, right? And so, and we didn't do any radical techniques to really change their like sense of well-being, but I think they have skin in the game, the
Mm-hmm.
way they want to show up and care for the patients that they greet every day, right? And we taught them that they actually have a advocacy role also in getting patients seen that day, and they have figured out solutions that we didn't know they could do, right? And so I think, I don't know, like my mind is kind of telling me I have a hard time when we try to drill in on strategies and techniques without having a bigger theoretical context or a set of assumptions about what is organizing our behavior. If we are organizing our behavior with a whole bunch of techniques, but each of those techniques map onto a deeper philosophy and we don't know that, then I think it's just problematic. It's like I tell my students, it's great that you know CBT and whatever you want to use, but I'm not particularly, impressed by behavior activation as a choice of your intervention. I'm more impressed by your entire reasoning and how you walk the patient into that context, right? So I just think about it that way, even in an organizational level.
And Deepu, thinking about the example that you just gave about the front desk staff, right? Because we've all heard about this like really dumb concept about like work life balance, right? Like get the hell out of here. What are we talking about? The one thing that becomes very, very interesting though is that intentionality of reminding the front desk staff about the why behind it, it causes them like it's that becomes life, right?
Yeah,
That's not work anymore. That's life. That it's like, oh, I'm going to be able to help and support my community by doing this, by understanding what is happening with BHC. Like this extra work, that becomes not work, that becomes life, breathing for them as an employee. And to be able to reinforce and re-engage about that constant why. I mean, that gets me hyped because again, so often in positions that we kind of discard and we're like, they're interchangeable, they're not doing things like they're pivotal in so many different ways. And so no matter what level of the organization, as long as there is that understanding, I put that in there, Deepu, about spending time with people about why we do what we do and making sure that's connected to a mission. That's powerful. That got me hyped, man.
yeah. I mean, how many of your front desk staff have an easy day? Anybody who's in the clinic? Like they have a very hard life. And now we're coming in and saying, hey, we got to do these same day handoffs. And that's our prime, like it's our prime directive. Well, that just added like 6 more steps to the things that they have to do to add a new patient, check them in while they're already in clinic, and check their insurances, check their coverage. We live in a healthcare system that doesn't support integrated behavioral health fully the way we want to, right? And so that's why I thought it was important to really not really just ask them to do this for PCBH, but no, like I knew we had to go deeper. And now the two ladies up front, they have a sense of accomplishment every time they come and report like a new way they figured out, right? Like they're like, "I'm better. You can go in, no issues." They figured out what superior health looks like, right? So they know the inner game of these systems that now we don't have like 10, 20-minute delays before we had to go see a patient. That's what
And
my
just to,
goes. Yeah.
right, just to sort of boil it down, what you did to help with that was sort of share more about what was going on with your team and why you needed to partner with them, like what, right, the changes that was going on in behavioral health and their role.
I would say I shared more about what we do with patients.
Yeah, okay,
Like, let me give you a view of what happens once a patient is like given to me for a warm handoff or when they're coming to see me for an appointment. Here's
great.
what we do in there. I introduce myself. I get to know them because we believe that treating their symptoms isn't really helpful, but really getting to know them and then helping them function better is more helpful. And then explaining what we exactly asked during the love, work, play, health, values, all of those conversations, and then how we end the visit, and then how we think about follow-ups. Like I just gave them the full play, right? Like it's
Yeah,
not it's not like a black box what BHCs do, and it shouldn't be to anybody in your team. And so that's what we did. Yeah.
yeah,
So we
that's
didn't talk
awesome.
about our team's burdens, nothing. We just talked about what we do for patients. And I think that
That's very
matters.
cool. Yes, absolutely. Kim, I know you put something in the chat. Would you feel comfortable coming off mute and sharing what your comment?
Oh, I put two comments in, but
Okay.
the first one was just that, yeah, like moving away from that term burnout. I think we've all heard this, is that like when, when I'm told that, oh, I'm burned out, or I'm thinking that I'm burned out, I feel like it's something like wrong with me versus, the term moral injury, which is, yeah, like, these terms of like productivity and, being called unproductive. And, there's a lot that is inherently demoralizing in these kinds of terms. And so yeah, it's like counterproductive in a lot of ways to talk about it with that language. And then so yeah, like talking about moral injury, like what really is sustainable? How do we give people some kind of energy to show up to work and be excited about what they're doing? And then so Deepu kind of talked about that. That was my second comment, is this kind of like getting involved in a QI project, or giving people some kind of leadership, some kind of feeling of empowerment, feeling empowered, kind of like what David was talking about, like that gives you life. That gives you life at work. And so and I think Colby's comment, that the turnover at the front desk, a lot of that is them just feeling overwhelmed and powerless. And I love that they got involved and engaged, because they're usually incredibly like over functioning for their level of work and pay, and what is expected of them, and so underappreciated by leadership. It's just leads to my own moral injury sometimes when I see some of that go down. So yeah, so hopefully that sums it up.
Yeah, I think that was great. Kind of giving people an opportunity, and kind of like Deepa, what you said, you don't have to do much other than share, like, here's what we do and here's how you're a part of that. And then sometimes the energy and the solutions to help just naturally flow.
Right. If I was a smarter academic, I would have turned that into a QI project, but obviously But here's the other thing too, with I think Kim, you talking about how leadership doesn't view some of the works that they do as precious, whereas we see that and we're like, oh my gosh, I can't believe they're going out of their way. So they have had different issues where I know I can use my power and position to advocate to protect them against certain things. So I've done that. So when, for example, there is like a strict rule of collecting copays when patients leave. And our system is still figuring out copays for same day visits, right? Like, and so we're working with leadership to create an internal policy to make that happen. So when this was happening, they had an issue. So we went to leadership and kind of said, hey, bring them into the conversation. Don't penalize them for things that you guys haven't figured out, right? And so, and I think that also helps. Which again, I guess in the larger scheme of thinking about well-being, that might be a component, right? How often are you advocating for
Yes.
people in position in the traditional healthcare structure are deemed lower because of the way our for-profit and capitalistic like systems are organized. And I think being able to like push back on that with the positions of privilege that you have, I think makes a big difference too, right? Because I have a skin in the game with them. Like if they're hurt, I'm hurt, and I don't like that.
Deepu, like, picking up on it, I've told this story before in different settings, so I apologize if people have heard this story before. Bridget and I, we had the fortunate opportunity to go to Nepal a couple of years ago, which shows a lot of privilege that I'll just state from the beginning, to go to kind of a medicine and compassion retreat. So the basic premise of the retreat was it was a Eastern philosophy Buddhist kind of practice for healthcare professions. And largely the people that were there was probably like 30 to 40 of us, mostly from the Western kind of healthcare system, most people from the United States. And inevitably, this conversation about burnout came up. And one of the teachers, one of the Rinpoches, was giving a lecture the one afternoon, and someone brought up this conversation about burnout and said, what are we going to do about the United States healthcare system? What are we going to do? And he said two things that still stick with me today. Like I think about it every single day, that has led to kind of different philosophy changes as well as behavioral changes. The first thing that he said was, what's worse than the United States healthcare system is not having a healthcare system. And he went on to describe kind of Nepal's healthcare system and just the different ins and outs and who can get access to care and stuff. And it was a humbling moment, because so often we get into this thing like we forget that there's so much privilege embedded with us being able to complain about our healthcare system, right?
Mhm.
And not saying it's perfect, and definitely not saying that, but it was a good reminder to us. It's like, not saying we shouldn't try to change it and shouldn't try to do different things. It was a good reminder. It's like, and let's recognize what we do have at moments. The second thing that he said was a more profound thing. Was he said, you don't transform systems, you transcend yourself. And one of the things that my mind went to as this conversation was coming with Kim and Deepu was, one of the things that we try to promote and preach as much as possible at CHCW is that you never allow a moment of gratitude to die with you. That is something that we constantly say across the team. Now, I would also pause to say, and I love how Deepu was also conveying this, like, don't use that as a strategy or an intervention, right? Because that's not going to work. It's like the same research that we know about, like donating to charity can be good for your mental health, but you can't donate to charity so you get a bump in your mental health. Like, it doesn't work that way, right? Like, there has to be a belief that this is something that is a good thing to do. So within that, this idea of trying to share moments of gratitude and appreciation with other people. And the one thing that I've started to do that I think is a great thing, especially as we're talking about elevating voices that might not get heard as much, anytime I send an email or a moment of gratitude to anybody in our organization, I always CC their one up. So for instance, if the front desk staff did something really well, I absolutely am going to CC the reception supervisor and the clinic manager. If someone, a medical provider, does a good thing, I'm absolutely CCing the site director and the CMO to try to make sure that this is not only this person is seen by me, but it's seen by everybody in the organization. And it's something that has had a profound impact. Now, again, I think don't use that strategy as like an engagement strategy, because I don't think it's going to work. I don't think it's going to have the impact. There has to be a belief about the importance of making sure that we see people in the work that they're doing and a value of uplifting them.
Ooh, absolutely. Yeah. I mean, those are, I didn't think of those as strategies, right? But I think it's part of the ecosystem that we're part of, where the immediate team that we work in, we try to do that all the time. When we had these repeated workflow issues, we had to email our chair and division chief. And in that letter, I kind of talked about how much these two ladies up front have contributed to resolving problems at the front desk. And I mean, to me, it was just acknowledging their intelligence and their native skills in taking care of these issues for the system. I mean, it meant so much to them, which I found out later, right? But it was just like, um, give credit where it's due. You know, don't take credit for things that you haven't done, right? And and so it's just kind of like guided by that. But I wasn't thinking about it as like, oh, okay, let me do this in this email because that'll definitely boost engagement. That'll definitely get more commitment and motivation on their part, right? It was just the right thing to do relationally and contextually.
So we're talking about, sort of sharing how other teams and folks have helped us in our work, lifting people up, deciding whether or not to include, I like the term one up, but their supervisor, just to sort of showcase, right? This person's doing a great job. Um, just sort of changing that energy. I really think this idea of kind of just like showcasing our work in behavioral health is really important. Deepa, you talked about that with your front desk staff. Some folks in Illinois, I got off a call today, they're doing that with their finance team and their grants department and not focusing that conversation on here are all of our problems and worries, although that is real, right? But sort of like, here's the work we're doing, here are the communities we're focusing on, here are the initiatives we're trying to carry through. And that energized the grants and finance team to think about, to remember, okay, this is what the work is happening. Where else can we sort of push for funding, or what other relationships in our state or community can we be developing to sort of mitigate some of these funding issues that we're seeing? So I think there's some really, despite everything that's been going on, there's some real innovation that's happening that we're hearing about. Anything like that happening for you, or any other things that are coming to people's mind as we're talking?
I just want to highlight real quick what Colby said. I love and just reading it, when we focus on finding moments of gratitude, that increases our awareness of things that we are grateful for. If we are looking for ways to share our gratitude for what we have, those around us, we will find more and more and more things. And I can, that's like a behavioral principle, right? Like we know that for sure. And I know Deepu has the same thing. Like it is amazing. This goes back to like transcend yourself. What's really amazing is that when I have now primed my mind to look for these things, it finds it everywhere. From last week, and I know this is always weird. It's like, oh, good for me and stuff like this. This is just like sharing a story. But last week, I was walking a patient back, and I heard one of our MAs walking another patient back to the room to like room them. It was the most engaging conversation I've ever heard. It was so kind. It was so caring. The way she did it, it was phenomenal. And so immediately after I got done with my visit, I looked back around and I was like, hey, you crushed that. Like that was incredible. And again, if we're not priming our minds to see it, that's just another day. That's a Tuesday, right? That's just another day that I gotta go see patients. I gotta go work with that. Priming your mind, as Colby said, like that has profound exponential ripples for us as far as the engagement we feel with the work.
Michelle, I see some comments from you. Would you want to jump off mute and share what you're thinking, if you're comfortable with that?
Can you hear me?
Yes.
Okay, great. I'm sorry. I just wanted to include that it's having rapport with the team is very effective in communication sharing and idea sharing. I think that's very helpful within any setting that we are part of.
Yeah.
Great, thank you.
Oh, Michelle, obviously, as you just said, building rapport with the team leads to open and effective communication. It's so funny, right? Like another topic that I get sick and tired of talking about is psychological safety. Like we almost do psychological safety as like, we're going to do an intervention to produce that's not how it works, right? Like I can tell Deepu for days, hey, bro, it's safe to have this conversation. Like, let's have this. And like the reality is like psychological safety is a response to a context. And part of that, and I love, Michelle, what you said there, is that building of rapport. We could do all these things about like, hey, be transparent, try to build up trust. And it's like, and the truth of the matter is like, that is a response to behavior. That's a response to a context. And when we start to recognize a little bit more, now the question becomes, how do we engineer context that produces these things just naturally, that we don't even have to talk about them? And I think that's a really powerful thing. So, Michelle, I love how you said that, like building rapport, sharing those wins, moments of gratitude, that connection actually produces another thing that we're constantly talking about, which is psychological safety, or how can we have open communication?
Mhm. I think by now you may have figured out, like Dave and I are like not very big fans of techniques and skills, but I think we're really, I think the fundamental question is, can you engineer and rewire your basic assumptions of how you want to show up personally, and then how does that penetrate or reverberate into the context that you're in, and then get people to be part of that framework, because then all the ideal behaviors then become a response to that context. It's almost like if you're watering a plant and constantly shifting it to the sun, but you haven't like changed the soil, then like you could do a lot and it might grow a little, it might flourish a little, but the fundamental context hasn't changed. And I think I'm far more interested in figuring that, like what's in the soil and changing that versus adjusting for sunlight all the time. And it's hard to have this conversation with leadership, right? Like, and advocate for that. But I think the more you're able to explain it and the more you're able to show it, demonstrate it, because that's truly what you believe in, I think people follow through on that.
So I'm going to play a little bit of devil's advocate.
Ooh.
This has been a great conversation, and I could tell that, and I completely agree, right? Showing up in a way that is lifting up our team members and being transparent about our work is helpful. And I know that on all of our minds is everything that's been happening at the federal level, everything we read every day, the fact that our work and our life's work is being questioned and sort of dragged through the mud. I know there's very real fear and experiences of people losing their jobs, of leadership sort of putting us on the spot to justify our work. And I think it's really important that we talk about tangible strategies or ways that we've been responding to that. So maybe you don't have a strategy, but maybe you can talk about ways you've been responding to that, right? So I know sort of what we've covered so far, and I think it would be good to focus just a little bit on if there's anything in your day-to-day that you're doing differently, leading your team, outcomes, initiatives, ways you've sort of shifted. Again, in Illinois, we've got some organizations looking at different patient populations that might be more available to serve than adults on Medicaid. Maybe they're focusing a little more on children. Maybe they're focusing a little more on Medicare patients. They're trying to talk more to their finance and grant departments, right? This stuff in my mind sort of like does bring down anxiety, because you're like, all right, at least I have a plan. That's how I work. After I freak out, then I make a plan. So if anybody has anything on that, I'd love to hear it. If you don't want to talk about that, that's okay too. But I think that would be kind of cool to touch on.
Stacey, I think it's a great topic, and I appreciate the intentionality, and one of the things that we always love, like the rumbling about different things. I think it's a good thing, because I think also philosophy and approach is great. Pragmatic kind of ways of doing things have a place as well. I'll just say from my end, from what we've been trying to do, I think one is just acknowledging that it just sucks. I think right now, I'm a very just kind of by engineering a very positive person. And I could definitely get accused of having almost like that toxic positivity about say, hey guys, it's okay. Like it's fine, right? So I think one of the things that I've been trying to just do as a leader more now is just making sure in every interaction, just, having that space being like, yo, where's your mind at? What are you feeling? What are you afraid of? Obviously, as you were just saying, being very pragmatic about what are the things that we can control and what are the things that are just going to be out of our control. I'm a big believer in not accepting premises. And I think that's a thing that has helped my career in a great deal is just like, I'm not going to accept the premise. I'm not going to be able to see my patients. I'm not going to accept the premise that I can't serve my community. I might have to think about it in different ways and operate in different ways. But I think that recognizing that undeniable, unwavering value is like, man, I'm living that. Like and we're going to come up with a way. It might not look the same, but we're going to come out the way to make sure it's done. I think the last thing my mind goes to is I think we should always be doing this. Look, man, I probably shouldn't say this, but F it, we're here, so I'm going to say it. But here's the thing: behavioral health folk, like we hate talking about money. Like we hate talking about money. And it doesn't make sense to me. It never has made sense to me. There's a great book called Conscious Capitalism. If you're struggling with capitalism and trying to get your mind to wrap it around it in a different way, Conscious Capitalism is a great read. It's by the CEO of Whole Foods, Mackey. I think the one thing with that is just being very transparent with your team about just what the realities are. I think so many times people get caught off guard because there wasn't an awareness of what was going on. And then all of a sudden it's like, boom, we got to cut this. And it's like, what happened? Where what we try to do with our team is that everybody on our team knows our budget. Everybody on our team understands where we're at as far as how our system makes money, how our CHC makes money. And then also not trying to demonize that either. I know there's so many different conversations like, oh, and again, I apologize. I'll shut up here very quickly. I know there's this conversation. It's like, well, I want more time with my patients. I'm like, hey, man, who doesn't, right? But I also think there's a conversation that we need to have. It's like more time with your patients mean less patients. And my
Yes.
community, like that ain't a great solution for the amount of people that have problems getting into primary care, the amount of people have problems getting into behavioral health and stuff. So I think all these different things we're just trying to have real honest conversations about, hey, I'm not saying we don't want more time with patients. I also want to make sure my community is seen and how that ties to finances, how that ties to all these different things that we're going through. So that transparency piece and just being honest, I think we steal people's autonomy a lot of times. It's like, oh, people are going to freak out if I tell them this. It's like, maybe, I don't know, but let me give them a chance to actually see what the response is rather than me making that prediction about what they're wanting to hear.
That's incredible. I appreciate you saying that. Basically, like your attitude is we are going to figure this out and it might look different, but we will figure it out, right? That's a really strong tone to set for a team. And also being really transparent and real about how finances affect our teams and work.
Yes.
So they're not shocked or surprised if anything happens.
Correct.
Right. So, or, they can sort of shift to sort of help things move along. I think that's great.
Yeah. And Dave works in a FQHC, so they have a different mechanism, whereas our clinic, when there's a same day visit, there is a copay collection and all of that. And that's a very uncomfortable conversation because they've already paid for a visit charge for the PCP, and then now they'll have another mechanism. And shifting to this current clinic, it's a full practice build clinic, right? And so that was one of the conversation, which is say, I don't want to shy away from this conversation because what we do and contribute to the patient care and the healthcare team is valuable, and my time is valuable, right? So I think behavioral health often gets into that corner of like, well, maybe we can work around. No, I don't want any workarounds. I want to figure out what the most appropriate way to do this, and kind of outlining that with the rest of the institution, right? Like, I think we were asked to figure out a lot of things, and I often like very gently, with respectively, to say, do the PCPs have to do that? And then if the answer is no, then I advocate for the same process to be applied for the BHC side, right? Because I just want them to start seeing and creating some equity around the roles that we play. I live in Texas, in the border region. We have lots of limitations that are being imposed. For example, people without papers not being able to seek healthcare. So our team is working for that. Like in our clinic, I will see anyone and everyone, and unless and until the system really kind of puts some certain guidance around that. We have some HRSA and federal monies that are here, which are prohibited from seeing patients that cannot furnish their documents. So I know our clinical leadership team is working around that for legal care. If we cannot, for financial reasons, if they cannot see us, we obviously can't provide a full consult, but we still go introduce our services. We actually try to get a quick sense of what they're overall struggling with and what their referring concern was with the PCP. And we try to give them things that they can tangibly do to improve their functioning, even in like a 12-minute conversation, right? Because anything below 16 for us is not billable. So, and so we, that might be taking some advantage of the loopholes, but we try to, because our job is to kind of care for our patients, and we try to do that. With the legal stuff, it's a battle. It's real. Like it's an evil, and evil needs to be named. And we, it's here. So we just had to do our best to continue to flow, and the flow here is providing patient care, no matter what the obstacles are placed in front of us. We don't have a perfect solution for that because of the outsized role of state and federal government, right? But I think as clinicians, we do what we can to make sure that our patients get touched with consultation and same-day visits as often as we can.
Mm-hmm.
Sometimes it's our system doesn't do telemedicine visits. Sometimes it's just phone follow-ups after the initial visit, and so that we're providing care, especially for the ones who need it the most. So that's how we back up all of the kind of like context-based values that we're talking about with like the reality of the stuff that's coming at us. I think the task with that is to not be overwhelmed by what do they call it, like flooding the zone, right? Like they are going to flood the zone, but we still can discern what we want to put our energy and time towards, right? And we're not going to get it right all the time. I don't have a perfect equity solution for the craziness that we're dealing with, right? But I do have a value-based directive that I can follow to make sure that nothing is compromised at the end of the day in my conscience, or I'm sure the collective conscience that all of us on this call might agree with. Is it going to be perfect? Absolutely not.
Thank you for that. I think something that also sort of gets to me is what really bothers me is sort of this anti-healthcare kind of like everybody in the field doesn't know what they're doing, right? Doctors are not to be trusted. That's really gets to me. And what has helped with that, I think, are finding some ways to respond to that. Because on some level, we've always had to have those conversations with people outside of our field to sort of explain why we're important. But it's kind of grown, I think, at this point. But sort of finding ways or something, I think, like on a social media, replaying this thought, like, the healthcare system isn't getting at the root causes of things. And the guy made like sort of a tongue-in-cheek video where he's like, I don't know, I just went to 15 years of medical school and just studied the pathophysiology of every single disease of the body, but I know I don't get to the root causes of things, right? So like having some sort of like response in your mind of like reminding yourself, what it is we do. 97% of Americans have to change one behavior to maintain or gain health. Why we're important, because we help people maintain or change their behavior for their health, right? Sort of like grounding yourself in some of those things, or like reminding or being able to sort of talk about your work faster in a way that people can understand is really challenging, I think, in our field, but it has helped me a lot.
Stacey, I love that. And adding to that, I think, and let me know, my mind says I don't think it's a rumble, but it might be a rumble. I also think we got to look at the context of why the public is saying those things too. I
Yeah,
think,
yeah,
right? I
I think it's
think
fair.
this is where, healthcare, look, we've had decades of like, shut up, listen to us, do what we tell you to do. And
Yep.
the truth of the matter is we were telling people to do dumb shit. And we need to, as a healthcare community across the board, and behavioral health as well, where, every single time someone comes in with trauma, it's like, we can't talk to you. You got to go see EMDR. You got to go do whatever it is. Like when we lose sight of humanity in a lot of ways. And I think one, let's call a spade a spade. There's a lot of misinformation that's going on out
Yeah.
there. There's no question about that. And I do think this is a time for us to pause a little bit. And it's like, why is this response? My mom is one of those people, right? That is like, oh, healthcare doesn't know what they're doing and stuff. And I'm always like, Mom, you got a son that works in healthcare. Like you understand, like you're saying that about me right now, right? And then there is a moment also recognizing of just being like, man, why is my mom saying that? Like, what are the contextual reasons for that? How much have we told people? It's like, again, I don't care what your beliefs are. I don't care what your values are. I don't care what your culture is. I don't care what what's going on around you. I know what's best for you. And I think that's a challenging thing that we should embrace a little bit more and almost make it a both and. Thinking
Yes.
about ways of, hey, we need to make sure we are getting knowledge out there and make sure we think critically about like, why is that occurring right now where people are feeling that way towards healthcare?
Yeah, being a little bit open to the criticism and what can we
Yes.
do to respond better to patient needs. I think that is excellent. I agree.
I think Travis gave a great summary in the chat.
Yeah, that's awesome.
Let's go, Travis. Travis, it's good to see you, man. Where's that? He put his camera up. It's good to see it.
He's making us sound smarter than we are.
I was gonna say, I know. It's like, Travis, was this ChatGPT that put this together? Was this Travis? Can I also say, particularly within the context of like BHCs, Deepu has helped me with this, and then, we're trying to expand this. Whenever we're talking with our BHCs, and I'm a big believer in evidence-based medicine, there's no question, and I'm a bigger believer in the context, and not asking people to do something that's dumb within their context. And I think one of the things that's really helped me as a provider, particularly if we're thinking about our provider-facing staff, is or patient-facing staff, is to ask yourself two questions before you go into every single exam room. And we try to prompt this with our team regularly. Is one, how does this person make sense? Like, coming back from that contextual thing, it's like someone's not waking up to be an asshole. Someone's not waking up and not trying to adhere to your treatment, things. Someone's not waking up just to be resistant. That's not what it is. Like, curiously search genuinely about how they make sense. And I think the last one is, how can I enjoy this human? Bob Rosenbaum told me about that from the single session mindset. It has profoundly changed my interactions with patients about how can I enjoy this person that I'm about to work with. And I tell you what, now when I go up and I pick someone from the exam room, I am hyped to see them because of that priming, And again, that's a transcending myself moment. That's something that, yes, I'm going to work to change the system and do all these different things. But the one thing the system hasn't been able to do yet, it might, but the one thing that the system hasn't been able to do yet, it hasn't stopped me from asking those two questions. And I have found a profound joy when I'm able to live those two questions out in the visits and interactions that I have.
That's incredible. I love that.
Mm-hmm.
How does this person make sense?
How do they make sense?
Yeah.
And you know what's amazing? It changes the questions you ask.
For sure.
Rather than you asking, it's like, what's wrong with this person? Which we got a bunch of questions for that, versus how does this person make sense? Like it changes the dynamics. And ironically, maybe not ironically, because it would be what you would expect, visits become fun.
That's beautiful.
Yeah, I like Kim's here about the anti-vax conspiracy agenda. Yep, internet trolls. Yeah, it's exhausting and deep away from the ability for deeper communication with patients. Yeah, I'll tell this story real quick, Kim, and I apologize. I should let Deepu go. So I remember I had a pediatrician the one day get me for a handout. This was before COVID, so it was 2019, and it was because he was super frustrated with the mom who was hesitant on doing vaccines, and this was really before a lot of the anti-vax kind of stuff was coming out in COVID. So I went in there and I was just very curious, and one of the things I learned very quickly is that the mom, her firstborn, during the 1-year-old kind of wild child visit where vaccines were given, 2 days later, the child died. Now, the it wasn't because of the vaccines. Like that, we know that. But if you're a mom, how could you not make that correlation? How could you not make that connection? And so I think it goes back to this same conversation. Like people aren't just waking up trying to be anti-vaxxers and piss us off. There's not that. Usually what it comes down to, and what's amazing, when I went back, I told the pediatrician about that, he softened because he's like, oh, okay, I can work with that. So I think these kind of stereotypes that we usually jump to about like why this person is anti-vax, maybe it is because of the internet troll. That my mom would be one of those people, right? Like just getting disinformation and stuff. But that makes me think about, it's like there could be fear that is associated with that, right? And so going back to, and Deepu, I'll pass it over to you where your thoughts go. Our moment of being able to see our human, Deepu, what's your quote? We're gonna return humans to them
Oh,
and us to
yeah.
ourselves. Yeah, what's your quote about that?
I say if we do our job well, we at the end of the visit, we're returning a piece of ourselves back to us and returning them to themselves.
And that right there, when we're talking about this conversation about anti-vaxxer, I had a patient during COVID. She absolutely was she didn't believe in COVID. She didn't do this. We had numerous conversations about the vaccine. She ended up getting the vaccine. And the point is, though, as me as a provider, like if my value is associated with her getting the vaccine or not getting the vaccine, I'm going to hate my job because I'm not going to be able to change. So once I gave up that fight, what was really beautiful is that we had a great conversation. She ended up getting the vaccine. But even if she didn't get the vaccine, the fact that the conversation occurred, the fact that there was an open engagement, and I wasn't trying to convince her, she wasn't trying to convince, we were coming up with this solutions and strategies and different things. I think that's where that power can lie. Deepu, where's your mind going?
No, I think I wasn't thinking about the thing that I usually say, but I think you're highlighting, I think, the larger sentiment of the work that we do, right? And I think, and again, I don't want to like trivialize burnout and other things that we experience, but part of that framing is like, what are we ultimately battling with? Like, and what are we, because part of the tension is we're trying to take people's autonomy into our hands, right? We want you to take this medication this time, and I want you to do this 2 times a day, poke yourself 3 times a day, all of that. And that's a hard ask on any well-adjusted human being, let alone somebody who's battling multiple multiple things on a given day. But my heart goes back to what Dave reminded me of. It's like, if we do our job right, the joy that we get is we found something new in ourselves, and in that process, the patient found something new for themselves, right? And that, if that occurs, then change might occur in a way that is meaningful and functional for them, which might ultimately align with the desires that we have, but we always don't hit that perfect mix of things, right? Because even like, I mean, all of you know MI stuff, right? With MI, you're not really trying to get them to quit smoking, right? Like you're trying to kind of get them ready for something that's important to them. I mean, we're not going in there with, I know like with expert and some of the other trainings, we almost make it like formulaic. If you ask a scaling question now, and then you ask a future oriented question and then values, then they're going to quit smoking. Well, I don't know. Like, it's not that. Human behavior and human beings are not that predictive. Like, we just don't have the predictive capabilities that we think we do.
Great. Thank you both so much. Thank you everybody for joining today. Thank you so much for your comments and your engagement in the chat. This has been a wonderful conversation. Please stay in touch. Join us for next month's conversation. If you have ideas, you can send them to us. You can reach out to us at any point just to keep the conversation going. But stay strong out there and do your best to serve your communities, and let us know how we can help. Thank you so much to David and Deepu. I hope you all have a good rest of your day.
Appreciate it. See you all.